Hello and welcome to this episode. Sean Brewster and Bo Leading with you once again. Bo, today we're talking about valuing yourself as a health practitioner. This is a topic that often comes up. It's one where I think a lot of practitioners find themselves in situations where they aren't getting what they want from their career, or maybe even their income, if we want to drill down that far. Maybe things are happening in and around their business that they aren't happy with. And I think it often comes back to this idea of how much do you value yourself first?
Yeah, it's a really important one, because you've got to put yourself front and center of what you're doing and make sure that it's fulfilling your life. It's providing financial rewards as well. And so, yeah, really valuing yourself it should be a number one priority of healthcare practitioners. If we can't value ourselves, it's difficult to then provide value to other people.
Exactly. And one of the things we often hear from participants in courses and just talking to practitioners around the country is that they'll often get quite frustrated when they have things like cancellations. Now, that's something that every health practitioner deals with. We're dealing with human beings, and human beings have lives, and things interrupt those lives sometimes. And of course, you'll get cancellations for bookings. But for some reason, I think some practitioners tend to get more than others. And again, I think the solution to this lies in the same idea of valuing yourself more, putting things in place to ensure that people recognize your value and don't cast it aside when making decisions about what they're going to do with their time. So we'll often engage with different businesses, but like you and I fly a lot. We travel interstate, internationally a lot. And, if you buy a ticket for an airline and then you decide a couple of days before that you don't want to go, or sometimes on the day that you don't want to go, and you try to cancel that and get your money back, it's a fair assumption that you're probably not going to get your money back. You would need to have a very good reason. It needs to have enough time in advance. And so the airlines have figured out a way to value themselves. And I think we can take something from that, because if we were to behave the same way and say, no, you've booked my time, I've put this aside for you, and if you're going to cancel at the last second, then I can't replace that with somebody else necessarily very easily. And so, things like cancellation policies, procedures, these things are ways that we can take ourselves more seriously in our professions, to ensure that we protect ourselves and the value that we're providing to others.
Yeah, you're right, Sean. It is frustrating. It is difficult. Um, but I think it's difficult for a lot of clinicians as well because um, we always tend to want the best for our patients, and we often have a bit of a relationship with them, which a lot of these larger businesses don't. And so we often be fairly lenient with cancellation policies and even no shows, which is even more unfortunate. And so that significantly impacts our time, our income. So like how do you then enforce something, or how do you actually I guess put something in place to stop this from happening, or to limit it? What do you suggest?
It's a tricky one, isn't it? Because, like I said before, we're dealing with humans, and you're right. We have relationships with those people, and we want to build trust and rapport. And often it'll be a patient or a client that we've seen for months or years. We really know them quite well, almost like a friend. And if they cancel at the last minute, you'll often go, "Well, okay, I know them well enough. They know me well enough." And there's sometimes room for understanding. It's when the people who are just booking out of the blue and you don't know them from Adam, and they just decide not to turn up, and that doesn't show respect for you and your time. And if you were just to let that go, then you, I think, yourself aren't showing respect for you and your time. So, we're drilling down fairly specifically here, but if we're talking about cancellation policies, you're kind of crazy not to have one, because if you don't have one, then people just assume that your time is no more valuable than anything else, and they can kind of just take it and then give it back whenever they want. And so, how do you enforce it? Well, first of all, there has to be a policy in place, and then you then have the option to enforce it or not. And I guess depending on and how often these things are happening, you might tend to lean more one way or the other. But I think it all comes down to the beginning. You've got to actually have something in place for you to refer back to and say, well, no, here's what happens if you don't show up on the day. Here's what happens if you cancel 2 hours before. Here's what happens if you cancel 3 days before. There's some processes to follow, and I think it gives everybody a little bit more certainty. And then at the end of the day, you, the owner of that business, you, the person who's going to be using your time, can decide what is an appropriate excuse to use it or not use it, I guess, in those situations.
Yeah, I mean, I agree, but it's difficult again if someone books an appointment. We often don't have any um, prepayment that's involved. Usually, payments taken either prior to the consultation at the clinic or afterwards. Um, so we've got a new patient that books in and they either cancel within a few hours or within whatever your policy suggests, or they don't show up. How do you actually enforce that policy if they've never been in before? It's a very good chance they just won't come back or they won't pay the fee.
That's right. And I think that in itself is a failing of a policy. Of course, it's quite normal to pay on completion of a consultation, but I'm seeing more and more commonly people are having this upfront payment or a collection of credit card details or something, and that's, I think, we book in for hotels, we book in for other things, and of course it's quite normal to put some secure, like a secure payment or a deposit or something on that booking, because there's a risk for the business if you don't show up. And so um, you know, it is quite normal, becoming, I think, more quite normal to have some sort of payment up front, and that does protect the person then for the no shows. You do have the option to then charge that patient for the time, and I guess if you're the kind of person who you're not quite sure whether you really want this appointment, I'm just going to book it and see how I go, then maybe that's not the practitioner for you. Maybe you are better off trying to find somewhere where you can just walk in or make appointments at the last minute. I think there's businesses for everybody. There are practitioners for everybody, and there are patients that will fit into those. Will be the square peg for the round hole, or there'll be the round peg for the round hole. They fit or they don't. And so, if I think you're in a business where cancellations, as an example, happening more and more often, then considering prepayment or some kind of collection of credit card facilities or details up front might be the next move, because that then demonstrates your value up front. The patient can say, okay, well, we're locking ourselves in here. This is an appointment I need to turn up to, or there's going to be some penalties, and fair enough too.
Yeah, I mean, I agree with all of these things that I often, with the internet nowadays, and there's so many options available. It's often, someone could get to that point, and it's a bit of maybe a bit of a barrier for some people, and they go, all right, well, I'll just go to the next clinic where I don't need to pay in advance because this appointment's 2 weeks away, or it's seems a bit far away to pay something in advance. Um, and I guess it always comes back to the booking system that the person is using as well. To take payment prior may require additional fees or an additional subscription to allow for that. So that often adds some other barriers. I guess also if you're working in a larger clinic and you are an employee or a subcontractor, um, that it may depend on the business policy as to how they enforce it and how that sort of gets reciprocated to you. So there are other barriers, I guess, to face.
100%. And these are all things to consider. And there's no two businesses that are going to operate exactly the same. But if we're talking about, in our first example here, of cancellations as being one of the things that happens when a practitioner or a business doesn't take themselves seriously, there are other things, of course, we can do. And some of those things might be, which a lot of people obviously do, which are, automated reminders in the lead up to an appointment, checking in with them the day before. Sometimes it's a phone call from the receptionist. I used to have a receptionist who would call all of my appointments the day of or the day before, just to check that they're okay and they're all ready to come in for their appointment the next day. And those kind of things really did improve compliance and appearances of appointments. When there's no contact between the booking and then the actual date of the appointment, often people drop off or they just forget. We're all human, like I said before, and those things drop away. So maybe it's not collection of details up front. Maybe it's touch points along the way where they are demonstrating that they're ready, that you're ready to see them, and that they're coming in, and they have an opportunity then to cancel if they need to. And then that buys you a little bit more time and flexibility. And so there's different ways of doing this, I think. But you're right. There are additional costs potentially associated with taking payment in advance. But if your business is suffering from cancellations a lot, then that might be that's something worthwhile, because what's it costing you to not do that? If you're a business that is booked out all the time, this is probably more likely where the cancellations are more of a problem, because if you're booked solid and then you're having to turn people away, and then all of a sudden, these no-shows are happening, that's a real negative impact on how things work for your business. And if you are booked solid, and then maybe having those prepayments and other things like that in place make a lot more sense and can be financially justified.
Yeah, and I think those reminders are an absolute must. You have to do them. Again, that can be an additional cost involved. But it's also an opportunity for people that, if you say provide 24-hour reminder, often those ones that are more likely to cancel will cancel from that reminder. So that's another opportunity just to buy a bit more time to fill that appointment, if possible. Um, but yeah, I think that's very important. Obviously, if you do have access to a receptionist or someone, if you've got a brand new patient booking in, that might be more, uh, I guess, a better reason to do a phone call as opposed to a text message. Um, but yeah, they're definitely important. Text message and or email. Text message is guaranteed to be checked. Everyone has their phone glued to them, so there's no excuse. And then there's more. You've got more evidence to then to enforce a cancellation policy, because they've received that message. Even if you one better if you have them acknowledge that text message, so reply yes or no. And then, if they don't show up or they cancel within that time period, then they've also agreed to that cancellation policy, and you're more likely to be able to enforce it.
That's right. Yeah. And let's expand this out a little bit further. And obviously, value is what we're talking about here today, which value ourselves and valuing yourself as a health practitioner. And value is largely comes down to perception. And so how you perceive yourself and how others perceive you is essentially how we derive value from something. You could look at two items of clothing. One has a brand name on it that we know, and one that doesn't. We can, well, that one's worth more because of the brand value that it holds within it. Whereas the two things could be essentially worth the same as far as materials and labor costs and stuff go. But let's talk for a second about then the experience of making that booking and turning up to the appointment. I can think of recently I had to make a booking to see a medical specialist for something, and I spoke to the receptionist. They did basically an interview with me to ensure that my time wasn't going to be wasted and that the professional's time wasn't going to be wasted. They took a whole heap of information from me. I had to spend some time booking in for that. And then I had to commit to a certain amount of payment up front. So I did the prepayment authorization, all those things. So there was no way that I was not going to turn up to that. And obviously, if you're a massage therapist, an osteopath, a chiropractor, physio, that level of time and commitment is probably not necessary. But maybe considering those as ideas, I think we can learn a lot from other professions, other industries, even going sideways into different industries, and seeing what's the procedures they use to make sure that you are valuing their time, that you're going to turn up and that you're committing up front. And if you're going to see someone, a health practitioner, but like you're well known for your skill and expertise in certain areas, and people will drive and travel to see you. And so if they're going to book in and see you and you say, look, I take payment up front, I think most people would probably go, yep, fair enough, I'll do that, right? Because there's a recommendation. But if you're just starting out, you're new, you haven't developed that brand awareness, people don't know you for a thing yet, they don't know your name and reputation, then these things are going to be harder. But I think ultimately what we should be doing, and I use the word should loosely because everyone's got their own path to this, but one thing we could be doing would be trying to think about where we want to be in the future and the things that we can things that we can put in place to ensure that we're moving towards that. And I think taking yourself seriously, valuing what you do as a practitioner, is a really good stepping stone towards that situation where people won't question the prepayment. They won't question a cancellation fee. They won't question, an intake form process that you have to go through and lengthy kind of processes that might sort of precede the appointment, because they go, well, this person is worth it, so I'm going to do it anyway. But that's, for many of us, a little further down the track. Just about aiming. It's where are you aiming for?
Yeah, it's a really good point as well, because if there is that perceived value of that practitioner, then absolutely people are more likely to go through those additional barriers. as a new practitioner, or you may be a practitioner in a larger clinic where they don't really know who they're booking in with. They'll just book in with anyone. That's usually when there's this comparison of facts and figures. It will be a comparison of price as a comparison of what they can do for me, their recommendation. And so if you're just comparing two practitioners based on price, yeah, the person that's cheaper will often win. But when it's from a recommendation or an area of expertise, price isn't a factor. In fact, price probably adds to why they would go and book with the more expensive person, because they must be better. And so this is often perceived very differently from different people, depending on what they want, what they expect to get from that consultation. So yeah, it's a really tricky one, I guess, because you could think that, well, if I'm cheaper, then I'll get more patients. Yeah, probably. But if you're also more expensive, maybe that's perceived to be that your quality and value is higher, and it may more likely attract those types of patients that you really want to see if you're aiming to specialize in a particular area. And then, like you said before, they are less likely to have those barriers of prepayment and consultation forms prior to the appointment. So it's a bit of a tricky one, isn't it? Especially if you are just starting out.
Definitely. And you made a good example there of, when you've got two practitioners that are maybe new and don't have that reputation, and one's charging this amount, another one's charging a little less, then often we'll go, well, I don't really know what I'm looking for anyway, so I'll take the one that's a bit of a better deal financially. At that point, essentially, when you're a new graduate and you don't have that expertise and that experience and that reputation, you're what we call a commodity. It's something that can be bought and sold, and at the lowest price, that thing gets bought more. It's like grain, gold, wheat, all these sort of things you can buy and sell. They're all the same, essentially the same kind of quality, regardless of where you get them, pretty much. But if you can get a better deal on it, then that's the way you go. Whereas if you're going to see a heart surgeon, because you're going to get a new heart put in, and one's charging this amount of money, and another one over here is charging twice as much. Well, you think, well, it's a heart, right? Like, this is pretty serious. I'm going to probably go, if I can afford it, and I'm going to find the money for it if it's my heart. I'm going to go with the better one. I want to know I'm getting the best thing. So to move out of that state of being a commodity, we need to move into this different operating kind of level. Like, we're pitching ourselves at a different place. And that again comes back to valuing ourselves. Now, if you're a health practitioner, you've been in the game for 5, 10, 15, 20 years, you've learned a few things. You've seen some stuff, you've got experiences, you've got knowledge, you've got abilities, you've got the ability to clinically reason and solve problems. That's worth something. That is really worth something. Now, the problem, of course, is a lot of practitioners will get stuck in the mindset of being a commodity. They'll price themselves accordingly because there's someone down the road that's a bit more, and they think, well, I'll just undercut them by $5 and that'll work. Doesn't it? It'll keep you at the same level as the other commodities. So if you want to step up, that it has to be reflected in price. It has to be reflected in behavior, and the way you structure your business, the way you present yourself to the world, the way you communicate. All of these things needs to change for you to be able to change. They say nothing changes unless you do, and that's, I think, perfectly reflected in this idea of valuing yourself.
Yeah, and the branding's important as well. I had an interesting example where I get nearly all of my patients through referrals. I don't get any that I really know of through just web searches. And maybe there's that barrier there as well, that people look at my price and go, oh, that's a little bit more expensive. But then I've also looked at other places and go, wow, like, you've got new grads charging pretty close to what I'm charging, just because it's a larger clinic. So that, you could run these comparisons. But I had another health practitioner contact me looking to refer a patient, and asked my price, and they're like, wow, that's really reasonable. And so there was an expectation that, based on expertise and experience, that I would be charging a much higher price than what I am. So again, there's that contrast there of what's expected, I guess, as an industry norm versus what's expected from an experience point of view. So it probably comes back to then, yeah, your branding, your marketing, and how you how that value is perceived.
Definitely, definitely. And perception is value. What we perceive something to be. You've got someone who just spoke to you there who's thought your price was lower than they expected. And so does that mean your price is too low? Or maybe it's just too low for that person and the category of people that they normally see. And so it's just, it's a set of scales. It can swing one way or the other. And I guess you've got to be happy as a practitioner where you are, where you've pitched yourself. And I've heard different philosophies and different theories around this, and people say that, if you're relatively booked out, then you're too cheap. You should put your prices up. Well, okay, if that's true, then your philosophy is to charge as much as you possibly can until you can't get away with it anymore. And does that feel right in your stomach? I don't know. Maybe it does. Maybe it doesn't. For some people, it will. Others, it won't sit right with them. So all of these philosophical approaches to how we run ourselves and our businesses do have to come down to us and our own ethics and how we want to not only pitch ourselves, but what makes us feel good and happy about what we're doing. And I know that when I was in probably the first 10, maybe more years of my clinical career, I was putting myself at a price level that was probably about on par with the people in my area. And then at a certain point, I kind of woke up one day and went, well, what am I doing here? Like I've been doing this for a while now, like a bit over a decade, and this was still early in the career, but a bit over a decade. I know things. Like I've got a reputation for being able to help people in a certain way. And so I put the prices up and I started communicating differently and presenting myself differently. And what you said before about it will attract a different type and a different quality of patient. That is 100% true. And to be honest, I felt like I was getting more out of my work because I was taking myself and valuing myself more seriously. Um, and that was reflected in outcomes. It was reflected in the quality of referrals I was seeing. And it was just a sudden shift in my mind. It was like, okay, what am I racing? Is it a race to the bottom to get as many patients as possible, as cheaply as possible? Or is it a race to the top to put myself separately and operate on a different level, no longer be a commodity, be something of value and something that's a little bit unique and different? And then the financial side of it becomes, I think, less important to you. You can sort of take the price off the table. It's like here's what I charge. It's what it is, and it's a high number. And the patients go, oh, okay. Well, the second they commit, they've committed to you and the treatment plan and all the things that you're going to deliver, not to a price that they're comfortable with, and they'll move away from with the second they're not. So you will get a different quality of experience from the patient, but also I think for yourself. I was certainly more satisfied in my clinical career when I made that move.
Yeah, and another example is when you look at a larger clinic that may have senior therapists or principal therapists, and they're usually always booked out. They're charging a higher rate, but a patient is going to look at that senior therapist and go, well, they must be the best. I want them, so I don't care what it costs. Because my injury, my pain is more serious. And so that's the other thing where the patient perception, that perceived value, um, and so marketing yourself that way. But we deliver a lot of professional development courses, and people who are investing time and money and effort into their ongoing professional development should be able to charge that little bit more, because you are now gaining more knowledge, more experience, and more skills. So you've always got to factor that in, because there will be people, if you're charging the standard rate, there are people who are completely new graduates, um, which is also fine, but they may not have as much experience as someone who has been in the industry for longer or investing a lot more time and effort into their ongoing professional development. So yeah, it's always got to factor that in, and it's easy to say, "We'll put your prices up," and there's often a lot of internal barriers from us to think, "Well, if I am more expensive, people are less likely to pay that extra money." A lot of the time, people won't really even notice 5, dollars extra, $10 extra, or even care so much. But a lot of that, the barriers actually come from us. And I even remember when I first started, we were charging like $88 for an hour consultation. And I felt so awkward about that, but now 10, 15 years on, it's the standard is at sort of 130 per hour minimum, right? And so
Yep.
um, times have changed and prices have gone up. But it's also difficult to get out of that way of thinking about, what am I worth? And
Mm.
so we've got to understand how much we actually are worth, how much time and effort we put into being better, and how many more people that we can help, um, even if that price is that little bit higher.
Yeah, right. And there's other things to consider too, is like where are you based? The demographic, the city, the town you're living in, prices are going to vary. 130 for where you are, Bo, is a good income. For somewhere else, someone living out in the middle of nowhere, 130 might be someone's weekly wage almost. Like it's a scale of difference from place to place. And like we started out really low. I used to charge $20 an hour when I first started, and I thought that was pretty good. Then I did some sums and went, well, that's how am I going to buy a house? That's not really going to work. And then when I first got qualified, it was $60 an hour, and I thought that's pretty good. $60 an hour. I don't Most tradies aren't even close to that. And now, things go up and up and up. Of course, the cost of living, and then just, it all expands from there. But I've seen people charging four times that, in the 200s for an hour consultation. And then there's others that don't charge per time. They'll charge for a consultation, and the time is what it is. Sometimes it's 5 minutes, sometimes it's an hour. You're paying for a solution, and that, there's different models and different ways of looking at this. And I think all are valid, all have a place. It's what serves your patient, your client population best, and what fits well with your heart and your head, and finding somewhere in the middle of that. But I think one of the concepts that floats in and out of my mind with this a lot of the time, when I hear people complaining or struggling with the idea that either they're not getting taken seriously or they're not going to earn enough out of their career, it's because I think they've got a part-time mentality. A lot of health practitioners in the manual therapy space, if we drill down to that, do have a part-time business. They might operate a few days a week, or maybe it's every day of the week, but a few hours a day. They might be juggling a family, other commitments. There's a family business they're a part of as well. All other things get implicated in this. And they go, well, I'll do that on the side. And anything that you do on the side never gets taken as seriously as it should or would if it was something that was your sole source of income and revenue for your family and their life and so on. And so if you are doing something part-time and you're struggling with your ability to get people to take you seriously and value your time, maybe the first thing that needs to change is just a shift in your own mentality about, okay, this might be a part-time business endeavor, but it's no less serious or less important or less valuable to the world than someone who's doing this every single day as a full-time business endeavor. So that shift in your mind might be a great place to start if you're struggling with getting the changes to occur that you want to occur.
Yeah, that's an important way to think of things. If like every person that comes through your doors should be, valued at 110%, and 110% effort goes into that person in the consultation, and also follow-ups around that. And so even that whole value, even with pricing and all of that sort of stuff, it's not just the value that you provide in that consultation block, whether that be 30 minutes or an hour, whatever that may be. There's often follow-up that goes with that, checking in with them. It might be sending through some exercises, documenting, right, might be sending through referrals, whatever it may be. That also comes into the total package of what they get in a consultation with you, not just looking at the very how much hands-on time they're going to get. It's that overall care package, and that same sort of thing. If it's just a part-time mentality where you go to work, you're just there to treat your patients, and that's it. There's got to be more to it. More that goes into that, and I guess just shifting that mindset to think that you are managing this person throughout their rehabilitation journey, and not just for the time that they're in your clinic room.
Mm, yeah, you're 100% right. I did see this little shift in mindset trick that you can kind of play with yourself sometimes a while ago. And you think about it like this, which was, I can't remember who said it, but they framed it up nicely. Imagine if your next patient through the door was the one that makes or breaks your business. So how well you do with this person will determine whether or not you can pay your mortgage this month, whether you've got can put food on your kids' tables, whether you can heat your house and fuel your car and all those things that you want to do to make sure you can stay alive. This one patient could make the difference, right? If you do a good enough job, they're going to refer you 100 patients, and their referrals will send you another 100, and your business will explode. So, how much effort are you going to put into that patient? What could you do? What are those extra things that you were just talking about that you could do to make sure that they walk out going, "Wow, I got my money's worth and then some out of that." And that's a small little shift. And it might just be a case of, okay, they've gone, they've left the room. Now, let me think about all the things that I did for them. What else could I send them? Give them maybe a video link or something, some additional resources to make sure they go away feeling like that was a good experience and I got all the information I needed. And then how else could you show them that you care? What kind of follow-up procedures could you put in place to check in on them and make sure that they're progressing well and they've got the support they need? And then what else could you do to just demonstrate value for that person? And so if you treat your next patient like that and then reflect on what you've done, the shift in your mindset, the little things that you've added, or maybe even subtracted in some cases, but added to the consultation, then go, now let's do that again for the next one. And if you do that for a week, the impact, the value impact has exponentially grown across your patient population. And the only thing that shifted was a perception in your own mind about the value of that patient. We've been talking about the valuing us, but to value us means valuing the quality of the service that we provide so that that trickles down into their experience and then they can go, well, that was worth it. And so a little subtle shift in perception, but I think that can be a really useful one.
Yeah, that's right. That value of valuing yourself about how much how good that consultation was, or how valuable that service was that you provided. Even if a patient, that they're not going to book back in because they might be traveling or traveling through or whatever, going that little bit extra, and making sure that you make this a very well-rounded consultation with additional information and follow-ups. Um, you know, they might then tell other people, and they tell other people from there, and the next time they're in town, they'll come and see you. So these things will pay off in the long run. It may not fill your book the next week, but this is sort of how you build that client base and that reputation over a longer period of time.
Definitely. Look, but all we've talked about here is little subtle shifts in the way we perceive things, the way we value ourselves, and then the way we act accordingly. And so I said before, but nothing changes unless you do. And so I think that's what it comes down to. If you're not happy about how something's going in your business, how your patients are responding to the things that you're doing, or their rates of turning up and cancellation, those sort of things, it just comes down to how can I think differently, which will lead to how can I act differently, and then how do I be differently, and then that's sort of how it starts. So this valuing yourself is an important process to consider, and I think an important one that will make a big difference over time.
Yeah, and just another point on that is probably, like, sometimes we'll often assume and come up with our own stories and own narratives about why certain things happen. But um, one of the hardest things to do, but can be one of the most effective things to do, is ask your patient for feedback.
Yeah.
Ask them, how did you find this consultation? Is this sort of what you were aiming to get out of it? Is this the direction that you were hoping to go in? Or was there anything that we could have done more or less of, or improved for the next time? Or, if they do cancel, you have a phone call with them and say, hey, can you just give me some feedback as to any particular reasons why? And they may or may not be completely upfront with that, but at least you're asking the question. So based on that feedback, then you can look at things a little bit differently and improve going forward. So yeah, it's definitely not easy to ask for feedback from patients, but they're the ones that we need the feedback from. They're the ones that are they're our consumers. So feedback from them is very important.
Yeah, that's such a good point. And it's just something I've heard you talk about quite a lot, I think is really valuable too, which is that getting that feedback at the end, which is super important to reflect upon what we've done well and could have done better. But one thing you often mention is too is getting that feedback at the start. Why are you here? What are you looking for? What are you trying to seek out that I might be able to provide? And then once you know what why they're in front of you, then you can say, great, I can help you with that, and here's how we're going to do it. Or that thing you're looking for there is not something I can help you with. That's not something I don't think I have the ability or skills or scope to help you with. So here's how I would recommend you'd go from here in that direction. Or maybe it's a combination of those two things. But setting that up from the start is a really valuable thing. And then at the end, you can reflect on that and go, okay, great. How did we go today? Is there anything else you think we might have missed, or is there anything else you wanted to cover? And then they've been bookended, haven't they, by this ability to really get what they want. They've told you what they want. Then they've been asked again, did you get what you want? Is there anything else? It's very difficult to be disappointed at that point, to walk away and go, I wish they had have done this. Because then at that point you have to reflect and say, well, that's my fault because they did ask. And so that's a nice fail-safe way to protect yourself against not being valued.
Yeah, couldn't agree more. Don't ask the question, how are you feeling? Ask, can you give me some feedback on how that session went today? Is that aligning with your expectations? And where do you think the next session should go?
Mm. And there's a difference between a closed-ended question and open-ended question. Is that how are you feeling? Good, bad. They're not going to say bad. Good. Now tell me how you're feeling. I need to use some descriptive words, and that's going to give you way more information. So you're spot on. That's great. Bo, plenty of good advice there. Thank you. Very good. Anything else to add?
That's it for now, I think.
Excellent. Yeah, it's a big topic. I think it's just something you got to consider, right? Just got to spend some time sitting in and going, which parts of my business, myself, my practice, my profession, my reputation, could I value more? And then draw from some of these ideas, hopefully, and expand upon it from there.
Mhm.
Very good. Thanks for listening, guys. We'll see you next time.
Cheers.